I am Dr. Adebanjo, and I am a radiology resident in Italy at the moment, and I hold a GMC full registration to practice. I am honored to have been invited to present this talk by DIMA because academia is a field that I'm really passionate about, and which I would love other medical students, people in the field of medicine, to be involved in. As you can see from the title of my presentation, I will briefly introduce you to how to perform a poster presentation, case reports, and literature reviews in order to gain access to the world of academia. So in this slide, you can see what I will talk about, and I will start by presenting you how our poster presentations performed, and I will then talk to you about case reports and literature reviews at the end. So let's start from poster presentations. What are poster presentations? They are formal, research-based presentations of your work, and they are a good way to start being involved in academia. And of course, they are something that you can add to your CV, and that can make you stand out in any type of application in your medical career. They are effective tools to share and communicate your research findings, and the feedback that you obtain when presenting them can be used to refine your research findings, which can then be prepared as a manuscript, which can be published in a peer-reviewed journal. They are a great tool to get noticed and to network with senior and junior members of your field of interest, and they are relatively more straightforward than having a research article published. First of all, because publishing an academic article in a peer-reviewed journal, it can be kind of a lengthy process. First of all, because of the peer review process, but also because of the writing process per se. Poster presentations can be presented multiple times, and that is something that I think not many medical students are aware of. Of course, you should be aware of the submission guidelines of each scientific event or congress, but generally speaking, poster presentations can be presented more than once, which means that the same research can basically appear multiple times on your CV, and then that poster presentation can be then published as an academic article. So what are the things which can present it as a poster? Generally speaking, you could present preliminary results of your research or your study, and this can be case reports, case series, case control studies, randomized control trials, but also secondary research, such as literature reviews. So what are the steps which are necessary to the presentation of a poster? First of all, you should submit an abstract, which can either be structured or unstructured, depending on its content. Case reports are usually submitted as unstructured abstracts, whereas other types of research are submitted as structured abstract, meaning that they should have an introduction, a main body, and a conclusion section. Abstracts which are submitted to submission systems of congresses and scientific events are usually pretty short. So they actually give you room to edit the text that you will then use in the proper poster. And the total word count, which is usually asked by submission systems, is usually around 250 words. But you should be aware of the fact that it will never ask you to submit something that is, let's say, like an essay, 400 words or more. When presenting a poster, it's really important to have specific section, a specific structure. You should have a title and authors with affiliation, an introduction with or background, a method section, a results section, a discussion section, and this, however, can vary according to the different guidelines. But you should remember that these are that roughly speaking, these are the main sections which will be required when preparing a poster. The layout of the poster can either be vertical or horizontal, but this, as I mentioned to you before, really depends on the specific guidelines of the event. So these are some general tips which I would like to give you in order to to successfully present a poster and to attract people when you are presenting it. First of all, you should avoid clutter and keep it simple. So you should not include too many tables, too many pictures, lengthy tables with a lot of numbers. You should also try to use the same fonts and have a asymmetric layout because posters should be visually pleasant. You know, they should attract the researcher, the person that is going to listen to your pitch when presenting your results. The colors should be kept simple, and you should emphasize the results section because it's the main part that you are trying to share with the scientific community at that specific event. I would also advise you to add your LinkedIn QR code or your email or a business card if you have one, so that the people who see your poster will then be able to contact you and network with you. And my last advice when presenting a poster is to have a pitch ready, meaning that you should prepare something that you will say when people are going to read, to look at, and to listen to your poster, so that you will then be more prepared to answer their questions. So I will now move to the second third of this presentation, which are case reports. And as I did before, I will start from the definition of a case report, or what is a case report. A case report is an article that describes and interprets an individual case, often written in the form of a detailed story. So case reports often describe unique cases which cannot be explained by known diseases or syndromes, cases that show an important variation of the disease or condition, cases that show unexpected events that may yield new or useful information, and cases in which one patient has two or more unexpected diseases or disorders. And as you can see from the pyramid that is on the top corner of the slide, case reports are not the, let's say, the best body of scientific evidence in the hierarchy of evidence-based medicine. However, they have the potential to be valuable sources of new and unusual information from clinicians. And that is why I believe they are a good starting point for medical students to publish an article. Um, they can deliver an educational and teaching message, and they have a high sensitivity for detecting novelty and are the cornerstone of medical progress. That is because the other types of research, which are on the top of the evidence-based medicine pyramid, are usually based in one way or another on case reports. For instance, systematic reviews, which are on the top of this pyramid, can also be performed based on a series of case reports. When performing a case report, I would advise you to follow the care guidelines, and I put this link on the bottom of the slide that you can easily access. But you can also Google care guidelines, case reports in order to find them. And these are guidelines which can help increase the completeness, accuracy, and transparency of published case reports. And I stress the fact that you should follow these guidelines because in some instances, when submitting a case report manuscript to a journal, the editors will ask you to complete a care checklist that is provided by the care website in order to ensure that you actually followed the proper steps in the process of reporting the details of your case report. Case reports are shorter than most other article types, and they should have 5 main sections. First of all, they have an abstract, then they have an introduction with a short literature review, then they have the main body of the manuscript, which is the case report per se, and then they have a discussion, which includes a detailed explanation of the literature review that you did before, and a brief summary of the case and conclusion. So let's dive into each section of a case report. We have the title, which is the first component of a case report that will be read by the readers, and it should be concise, informative, and relevant to the subject. Ideally, the title should attract the reader's attention and should state the focus of a particular issue without being too cumbersome or artificial. And my suggestion is not to to repeat the fact that the article that you are submitting is a case report. For instance, you shouldn't say, let's say, a patient with lymphangioma, a case report. You should probably just write a patient with lymphangioma who presented with, let's say, with fever. I'm just saying something random. But the thing is that you should not repeat in the title that your article is a case report because it would sound redundant. Then let's talk about the abstract. The abstract is a short summary that gives an overall idea about the content of the case report. It is usually quite brief and generally shorter than that of other types of articles. It should provide essential information, which allows for easy retrieval from electronic databases and helps researchers determine their level of interest in the case report. The next section of a case report is the introduction. The introduction should provide the background information on why the case report is worth reading and publishing, and provide an explanation on the focus of the case report. For instance, if you're reporting a case of, let's say, a cutaneous manifestation of COVID-19 in an ICU patient, in the introduction section, you should briefly introduce COVID as a disease, and then the fact that these manifestations can encompass different body systems. That is the fact that COVID-19 can have respiratory manifestations, GI tract manifestations, nervous system manifestations, and so on. The second part of the case report is the case description or summary. In this section, the case report should be presented in a chronological order and in enough detail for the reader to establish his or her own conclusions about the case's validity. It is important to include all negative findings and to omit your own interpretation of the case report. It is really important to include figures and tables as well, so that the clinical data that you are reporting is complemented by visual and numerical data as well. The next and final section of a case report is the discussion. The discussion has many functions. The first one is to summarize and interpret the key findings of the case report. The second one is to contrast the case report with what is already known in the literature and justify its uniqueness, meaning that you should say why your case report is worth publishing and why it stands out from the medical literature that has already been published. And lastly, its function is to derive new knowledge and applicability to practice and to draw clinically useful conclusions. In this section, you should compare your new case to prior knowledge and you should briefly summarize the published literature and showing what aspect the present case differs from the previously published cases. And it is important to remember that this section is not designed to provide a comprehensive literature review, meaning that it is quite normal that a certain condition would already have been talked about in many forms, meaning that, let's say, if you were to report the case of a COVID-19 patient with cutaneous manifestations, there are many literature reviews which have already been published about this topic, but in your discussion section, you should only mention a few so to make it relevant and to provide a proper context to the case report that you are sharing. And finally, in the discussion section, you should include any limitation of the case report and its significance, and the significance of each limitation. For example, you could include the fact that you were not able to collect a certain clinical value because it was not available, or because the patient didn't sign a consent to share that specific data. And finally, the value of the case that adds to the current literature should be highlighted. Now I will pass to the third and last part of this presentation, which are literature reviews, which are a bit more complicated than the two research tools that I've talked about so far. And as I did before, I will start from the definition of literature review, which is a comprehensive summary of previous research on a topic. That is a secondary type of research. What is secondary research? Secondary research is a type of research that is performed based on data that is not novel, it's not experimental. Secondary research is a type of research that is performed based on data that has already been published. And what is the function of the literature review? A literature review creates a landscape for the reader, giving them a full understanding of the development in the field. There are different types of literature reviews. For instance, there are narrative literature reviews, scoping literature reviews, and so on. In this table, you can see some examples of the types of literature reviews which can be performed. There are systematic reviews, which are the more rigorous ones and that follow the PRISMA guidelines. Then you have meta-analysis, the qualitative and quantitative ones, which are a step further than systematic reviews, and they are not always performed because of certain conditions that I will mention to you in the next slides. There are Cochrane reviews, scoping reviews, narrative reviews, critical reviews, conceptual reviews, and state-of-art reviews. In the following slides, I will focus my attention on the main characteristics of narrative, scoping, and systematic reviews, and I will then give you a brief overview on systematic reviews. In this table, you can see the main differences that there are among these three types of reviews, which I think you should be able to remember, because they are the ones which, let's say, in my opinion, are more accessible to medical students. The main differences between narrative, scoping, and systematic reviews are in objective, methodology, and application areas. So let's talk about the first difference, which is the objective. The objective of a narrative review is to identify and summarize what has previously been published. So the main goal when performing a narrative review is to deepen the understanding in a certain research area. The research question that is answered when performed the narrative review is pretty broad. However, the data synthesis and interpretation are extremely subjective, and they can be biased by the author's intention and previous knowledge. Then, if we were to climb the stairs of evidence-based medicine, we would find scoping reviews, which they are pretty similar to narrative reviews in the sense that they still answer a broad question, but their data synthesis and interpretation is more objective and less subjective compared to narrative reviews, meaning that the synthesis is more is still qualitative, but not like the one of narrative reviews, and the interpretation is based on the data that is included, and it is not based on the subjective interpretation of the authors, as it is the case of narrative reviews. The objective of a scoping review is to assess the extent of the available evidence, to organize into groups, and to highlight gaps. Scoping reviews can also be used to decide whether or not it would be useful to conduct a systematic review. And one of the caveats is the fact that they don't make implications for practice, and they have limited implications. Then, on top of the evidence-based medicine validity of literature reviews, let's say, we can find systematic reviews, which are the ones which actually follow pre-specified guidelines, which are the PRISMA guidelines, and they answer a clearly defined research questions. So from this table, you can see that while on one hand, narrative reviews and scoping reviews answer a broad question, which is not well defined, systematic reviews are actually the ones which are able to answer focused questions which are clearly defined, as we will see in the following slides. The methodology in systematic reviews follows specific guidelines, which are not available for scoping reviews and narrative reviews. And the interpretation is based on on the data that is included and is made as objective as possible. The objective of systematic review is to provide a concrete guidance for evidence-based practice and policymaking, and they are the gold standard in evidence-based medicine. So after what I told you, you could easily realize the fact that systematic reviews are the ones which are preferred by academic journals when deciding which type of review article to accept and then publish. However, because of the complexity of a systematic review process, I feel like medical students should start by performing narrative reviews, which still have a potential to be published, because it is important to realize that systematic reviews cannot always be performed because of some methodological limitations, which I will mention to you afterwards, and the fact that they still hold value in the medical literature landscape. So how can you decide if a systematic review is the type of review that you can actually perform and have published? You should answer all of these questions to decide if a systematic review is your article of choice or not. Do you have a clearly defined clinical question with established inclusion and exclusion criteria? Do you have a team of at least 3 people assembled? And why is that the case? You should have at least 3 people performing a systematic review in order to reduce the risk of bias, selection bias, and other types of biases as much as possible. Meaning that if you were to perform a systematic review on your own, first of all, you would have a high risk of bias when performing your literature search and then interpreting the data. Second of all, your article will not get published because in the methodology section, it is compulsory to specify how many authors and which authors, who are in the author string, performed each step of the literature review. So it's not like something you can cheat your way into. Uh, it is actually compulsory to specify who did what when performing a systematic review and having it published. Then, in order to decide if a systematic review is your article of choice, you should ask yourself if you have enough time to go through the results that you might have found. Then you should ask yourself if you have the resources to get foreign articles appropriately translated. And finally, you should ask yourself if you have the statistical knowledge and resources to analyze and pull data. If any of the if you answered no to any of these questions, then a traditional literature review is the more appropriate type of literature review that you should perform. A traditional literature review is a narrative review, so it's the one that I showed you in this table. So, which are the steps to perform when performing a systematic review? So, I summarize the steps which are necessary to do so, but I also would like to tell you that the first steps, meaning the ones which come before the data analysis part, can roughly be used as a guide to perform a narrative review as well. So the first step is to define a research question. The research question is the one that defines the topic of your systematic review and how the process will go. So one tool that you can use to define your research question is the PICO framework. The PICO framework is one of the most famous tools to define research questions. However, there are other tools which are also available and that you can easily Google. And I will provide you a PDF file with all the frameworks that you can actually use to do so. So what does PICO mean? P means patient. That is the patient or problem that is being addressed. I means intervention or exposure that is being considered. The C is the comparison, intervention, exposure where relevant. And the O is the clinical outcome of interest. In the table that I put below, you can see an example of a PICO question, where the P, patient or population, are patients with diabetes mellitus. The I, intervention or exposure, is the use of antibiotics after root canal therapy. C, comparison, is the avoidance of antibiotics or the use of a placebo after root canal therapy. And the O, outcome, is the reduction in pain and complication. Before finalizing your research question, one additional important step that you should do is to actually check if a systematic review that answers your same question has already been published. And you can do so by either performing a quick search on PubMed or Web of Science, or by checking the Prospero database, which is actually a database of prospective systematic reviews, um, which which has been provided by the University of York. and by the NIH. Then after you have defined your research question, the next step in performing a systematic review is to determine the inclusion and exclusion criteria. You should determine the time frame that you would like to screen, to analyze, what type of articles you would like to include. So you should determine if you would like to perform a systematic review of case reports, randomized control trials, case series, or case control studies. Then you should determine the conditions and the diseases to exclude. For instance, in the example that I showed you before, you could decide to include all types of diabetes, meaning type 1 diabetes, type 2 diabetes, diabetes of the young. And then you could also decide, for instance, to which antibiotics to include in the intervention section, and so on. So you could apply this to all the 4 letters of the PICO framework. In the inclusion and exclusion criteria, you could also decide which languages you would like to include, meaning that you could screen articles which have been published in English only, or you could apply no language restriction. And in that case, you should make sure that you have people who are actually able to read and screen the titles and abstracts of those articles which are not in English. The third step that is necessary to perform a systematic review is the one that involves the creation of a search string. A search string is the one that will then be applied to the databases that you will screen, and it derives from the PICO question that you have developed. In the table below, you can see an example of a search string that has been used on PubMed. And I provide you another example from the PICO table that I've inserted in this slide. For instance, if you would like to create a search string for this PICO question, you could use diabetes mellitus, the word diabetes, the word type 1 diabetes. You could use insulin, which is a really broad term when you're looking for a condition like diabetes, but it could be included in your search string. Then for the intervention part, instead you could include antibiotics, you could include antimicrobials, and in the outcome section, you could use complication, you could use the word negative outcome, and so on. Then an additional tool that you could employ when applying your search string to a database are Boolean operators, which are and, or, and not. And as you can see from the picture on the bottom corner, these Boolean operators are used to connect the keywords that you have derived from your PICO questions together. So now that you have a search string in place, you should apply it to at least 2 databases. And it is important to remember and to keep in mind that when performing a systematic review, at least 2 databases should be used and no more than 5 should be screened. Some example of medical databases are PubMed, which gives you access to Medline, Scopus, Embase, Web of Science, Cochrane Library, and Google Scholar. This is something that is compulsory when performing a systematic review. However, if you are performing a narrative one, you can use only one of those. It is not compulsory to use at least 2 of them. Then the next step is to download the results on a citation manager, and there are many which are widely available. They are mostly free to download, and you can download any of them according to your preference. I personally use the last one, which I think is very straightforward, but you can use Mendeley or EndNote as you wish. Then after you have downloaded your results on a citation manager, you have to screen the titles and abstracts according to your inclusion criteria so that your subset of results will become smaller. Once you have screened your results one time, you should then read their full text and perform that extraction. And in this step of the systematic review, it is likely that more articles will be excluded because you will find something in their full text that doesn't comply to your inclusion criteria. After you have performed the data extraction, you can organize your results in an Excel sheet with the most important information to analyze, and then you can perform the data analysis. Um, Throughout these steps that I talked to you about is fundamental to document everything, and you can find all the steps that you should follow in doing so in the Prisma guidelines, because there is a specific flow chart that you should fill in whenever you are performing a systematic review. Then for what concerns the data analysis, it is important to look at your data from as many angles as possible. You could start by grouping the studies in different categories according to sample size, type of outcome, study type, and so on. And you should ask yourself, do the included studies show similar results? Are they affected by some type of bias? Uh, do they have the same or similar study characteristics? Um, the data analysis step of a systematic review is something that can become quite complicated if you are not familiar with statistics. But I feel like basic um, the basic data analysis steps can be also performed by a medical student if they are um, properly tutored or mentored by someone, or they already have some type of statistics knowledge. The In some instances, as I mentioned in the previous slides, a meta-analysis can be performed at the end of a systematic review. This is not compulsory and it is not always possible. What is a meta-analysis? It is a statistical method to summarize the results of independent studies. What a meta-analysis does is combining the information from all relevant studies and create an estimated effect um, of all these studies. Uh, there are some softwares which can be used to perform meta-analysis, and one of these is RevMan, which I think is a pretty straightforward program software. However, as in the case of the data analysis part of a systematic review, um, I feel like it's something that you should become familiar with or have someone to actually explain to you how it works. However, I will create a short, straightforward guide so that you guys can actually get an overview of this type of programs, softwares. Um, an additional guidelines which are available online when performing systematic reviews are the Cochrane handbooks, which are updated periodically, and which include the methodology that should be followed when performing systematic reviews and meta-analysis. They are pretty lengthy, but they have summarizing tables on their website, which I feel like can be screened pretty rapidly if you guys are interested in performing systematic reviews, even as an exercise before actually performing one that you will be able to publish. So let's go to the writing process of a systematic review or of a review in general, because these are the sections which can be applied to all review articles. There is an introduction, which should be written before performing the search so that your previous knowledge is not influenced by the results of the systematic review. And as in the case of case reports, the introduction provides an overview of the systematic review and enough contextual information for the reader to make sense of the remainder of the report. My suggestion is to include an hypothesis in the introduction, meaning that at the end of the introduction, you should add, you should openly specify what is the aim of your review, meaning that, for instance, you should specify that you're trying to summarize the published knowledge regarding multiple sclerosis, or the available medical literature regarding the let's say the cutaneous manifestations of dermatomyositis. That's just an example. Then there's the methods section, which should be well structured in the case of a systematic review, but which can be, let's say, less organized in the case of a narrative review. In this section, you should write the details of your search string and the databases that you searched. You can either copy and paste the search string, like go back to. You can copy and paste the one that is at the bottom, like you can literally copy and paste it in the text, or you can just say that you searched certain terms which have to be specified in a number of databases. For instance, you could write that you searched the term prostate and cancer in PubMed and Web of Science. Then in the method section, you should specify the types of articles which you screened, the types of articles and the parts of the articles that you screened and that you included, meaning that you should actually say that you went through the titles and the abstracts of the articles that you found, and that you decided to include case reports and case control studies in your article. You should also specify the time frame that you analyzed. You should specify the languages that you decided to include, and you should also specify all the other variables that influenced your search. For example, you should specify if you were only interested in articles which were published in Germany, for example, or if you only looked at articles which have been published in Europe and Asia only. Then there is the next section, which is the results section, in which you should write and specify the number of studies that you screened, the ones that you deemed eligible and included in the review, with reasons for exclusion at each stage, meaning that you should say that you removed a certain article because it wasn't in English. You should say that you didn't include another article because the full text was not available, or because it didn't come from one of the countries that you wanted to gather information from. Then in the results section, you should also provide an overview of the kinds of studies that you selected, meaning the types of methodologies that were used in the articles that you included and their study design. You should provide the basic characteristics of the included studies, so where they were performed, the treatment duration, the details about the participants, for instance, their gender, their age, their comorbidities. You should state the similarities and differences in the way the data was measured, meaning that you should state if in certain articles the data was categorical, or if it was numerical data, continuous data. You should also state the similar or different approaches to the same treatment or condition. And you should also discuss the risk of bias across studies. I'll give you an example. You should state if one study had a limited amount of participants compared to another study which had a higher amount of participants, making it more statistically significant. And finally, in the results section, you should talk about the results of each individual study, meaning that you should say, you should talk about their outcome. If in the case of the PICO about diabetes, they favored the use of antibiotics in diabetes patients, or they didn't. The next section of a review article is the discussion section, which is a summary of main findings. And as you can see from this slide, there are many similarities with the discussion section of a case report. However, in the discussion of a literature, you should add some points, some sentences which show that you critically analyzed the data that you inferred from your search. So you should not only summarize your main findings, but you should also interpret them. However, you should not repeat the results. You should state the strengths and weaknesses of your study. You should compare your findings to previous reviews or the general literature. You should talk about the degree to which your review answers the research question, because in some instances you may formulate a research question which is not fully answered by the results that you have found in the literature. And you should also state whether or not your hypothesis was confirmed. It is fundamental to state the limitations of your article. So you should talk about the biases, the lack of methodological rigor, or weak evidence in the articles. My suggestion is that whenever you're writing a discussion section of an article, of a review article, especially a systematic review article, you should always talk about the types of biases that are intrinsic to each study, but also the biases that you have encountered yourself while performing this review. For example, you should mention the fact that you may have been influenced yourself by reading these articles or by your previous knowledge. The fact that your search could have been influenced by the publication bias, which is the fact that these studies which are published in the medical literature are usually the ones with a positive result that favor the hypothesis of the authors. You could also talk about selection bias and some other type of biases which are pretty frequent when performing this type of studies. We then have the conclusion section, which is a summary of how your article summarizes the research question. So it is basically take home message. Then you should talk about the significance of your findings, the reminder of your limitations, and the implications and recommendations for further research. One thing that I would like to add to what I have told you so far is the fact that systematic reviews can basically be performed on any type of body of literature, meaning that you can perform a systematic reviews based on case reports, on randomized controlled trials, and even on other systematic reviews. One other thing that I would like to add is the fact that when performing the actual search, when applying the search string on the different databases, it is also possible to screen the so-called gray literature. By gray literature, I mean medical literature that has not been published on, let's say, regular medical databases, but which is available online. For instance, on the, let's say, on medical journals which are not indexed in the databases that I mentioned, or other articles with medical value, with scientific value, which are not part of these databases, of the official ones. So I would like to end my presentation by saying that poster presentations and case reports are a great way to start being involved in academia, and you should not be afraid to reach out to your mentors and senior medical doctors or medical residents who work with you in order to get started. Literature reviews are a bit more complicated than poster presentations and case reports, but I believe they are not something that it's unattainable by a medical student, because I did a literature review myself when I was a medical student, and I was able to get it published. So I encourage you to think about a topic, to perform one, and try to get it published. You could also reach out to a professor, to a mentor, in order to find a specific research question to answer if you do not have one in mind or cannot come up with one yourself. An additional suggestion that I would like to give you is the fact that you should not be discouraged by the referee's comments when sending manuscripts to journals, because sometimes their comments can be pretty harsh, and they can make you feel like you're not, I mean, worthless is a strong word, but they make you feel like you are you are doing something that you're not supposed to do. But I feel like you should use their comments in a constructive way, and in many cases what they say is something that you can implement in your manuscript, so that you can edit it for a future submission to a different journal, so that you can eventually have your article published. And yeah, that's it. And I hope you found this presentation useful.